Today we are going to discuss about the pelvic arterial anatomy in female pelvis. This is the 3D model of the pelvis. Here we could see sacrum and coccyx in the midline, and on either side is the hip bones. This is the sacroiliac joint. This is the greater sciatic notch. This is the ischial spine, lesser sciatic notch, ischial tuberosity, obturator foramen. This is the sketch diagram of pelvic artery in female pelvis. Here we could see this is the common iliac artery that divides into external iliac artery and internal iliac artery at the level of sacroiliac joint. This internal iliac artery divides into anterior trunk and the posterior trunk. Anterior trunk predominantly supply the pelvic organs and the perineum, and the posterior trunk supply the pelvic wall. This posterior trunk give rise to three arteries. This is the iliolumbar artery. This is the first branch arising from the posterior trunk that supply the iliacus muscle, the psoas muscle and ilium. And the second branch is the lateral sacral artery, which enters through the sacral neuroforamina and supply the sacral nerve roots. Posterior trunk continue as superior gluteal artery, and it exits the pelvis through the upper part of the greater sciatic foramen above the piriformis muscle, and it supply the gluteus maximus muscle. This is the anterior trunk. The first branch of the anterior trunk is the umbilical artery, and in adult the umbilical artery get obliterated and continue as median umbilical ligament. The proximal patent portion of the umbilical artery become superior vesical artery that supply the urinary bladder. Second branch is the obturator artery. The obturator artery traverses along the lateral pelvic wall and exit the pelvis through the obturator canal, and it divides into the pubic branch and the ischial branch and supply the medial part of the thigh. Next branch is the uterine artery, and from the uterine artery the vaginal artery arises. This is the inferior gluteal artery, and this is the internal pudendal artery, and this is the middle rectal artery. So anterior trunk frequently continue as inferior gluteal artery and exit the pelvis through the lower part of the greater sciatic notch. The inferior gluteal artery is the second largest branch of the internal iliac artery. This is internal pudendal artery. Frequently it arises as a common trunk with inferior gluteal artery, and it exits the pelvis through the lower part of greater sciatic foramen, and it curves around the ischial spine and re-enter the perineum through the lesser sciatic foramen. This is the lesser sciatic foramen, and it runs in the pudendal canal along the ischial rami, and it supplies the perineal structures. This is the cadaveric specimen of lateral half of female pelvis. Here we could see that this is the common iliac artery divided into external iliac artery and internal iliac artery, which divides into posterior trunk and anterior trunk. This is the umbilical artery, which is obliterated here, and this is the obturator artery, which is exiting the pelvis through the obturator canal, and this is the posterior trunk, which is continuing as superior gluteal artery and exiting from the upper part of the greater sciatic foramen. This is inferior gluteal artery and internal pudendal artery, which are exiting through the lower part of the greater sciatic foramen. This is the 3D rotational angiography of left internal iliac artery. This is anterior trunk and this is posterior trunk. The posterior trunk is continuing as superior gluteal artery. This is inferior gluteal artery, which is arising from the posterior trunk, and at the lateral aspect we could see that various branches of superior gluteal artery which is curving upward, and this is the inferior gluteal artery, and both the branches are supplying the gluteus muscle at the gluteal region. Here we could see the iliolumbar artery, the branch of the posterior trunk, which is entering the L5S1 neuroforamina and supplying the nerve root, and these are the branches arising from the posterior trunk and the inferior gluteal artery, which is supplying the sacral nerve roots. This is the uterine artery, and these are the arcuate branches supplying the uterus. This is left internal iliac artery injection, which showed the various branches of posterior and anterior trunk which are overlapping in this anterior-posterior view. In this unsubtracted view, we could see there is a pattern. There are certain branches which are directed towards midline. Then there are certain branches which are fanning outward toward the iliac blade. Then there are certain branches which are moving towards the hip joint and towards the obturator foramen. So the easiest way to identify the uterine artery is that uterine artery has three segments: the proximal descending vertical segment towards the lateral wall. Then there is a horizontal segment which traverses in the broad ligament, and then there is a vertical segment which is vertical ascending segment along the side of uterus. Superior gluteal artery is identified by its upward curve bend which is exiting through the greater sciatic foramen and is fanning outward toward the iliac blade, supplying the gluteus muscle here. And the inferior gluteal artery is the second largest branch of internal iliac artery that is seen moving towards the hip joint. The obturator artery generally has two terminal branches supplying the pubic and ischial rami. The internal pudendal artery, sometimes we could see the blush around or in the region or below the symphysis pubis. We could see the blush of bulbous spongiosus. The various branches are better separated in the oblique view. So in this oblique view, you could see the anterior trunk, and this is the uterine artery. The internal pudendal artery is identified by its course, and we could see that there is a bent, forward bent at the level of ischial spine here. And this is the posterior trunk, and this is the superior gluteal artery, and this is the inferior gluteal artery arising from the superior gluteal artery. This is the 3D rotational angiography of left internal iliac artery. Here we could see that this is the anterior trunk which is giving rise to uterine artery, and then there is one branch which traverses downward, and at the level of ischial spine it is bent forward and running at the lateral aspect of the inferior pubic rami, and this is the interpudendal artery. This is the sketch diagram of female perineum, and here we could see that this is the internal pudendal artery which is traversing in the pudendal canal and supplying the clitoris and bulbous spongiosus here. And the internal pudendal artery branches also supply the muscles of the perineum, including the muscle of the anal sphincter. This is the superselective injection of internal pudendal artery in female. Here we could see the various branches of internal pudendal artery supplying the labia, and we could see the blush of the bulbous spongiosus supplied by the internal pudendal artery branch.